Who is at risk for Group A strep infections? What are some tips to improve health communication during patient encounters, including for topics like vaccination? Is behavioral counseling to support breastfeeding worthwhile? We'll discuss this and more in this episode of the JAMA Editor Summary. Hello, and welcome to our listeners around the world. Today is Friday, April 11th, 2025. I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. I'm joined by JAMA Deputy Editor, Dr. Preeti Malani. Hello, Preeti. Let's get started and talk about the epidemiology of Group A strep.
Hi, Kirsten. First up, authors Dr. Gregory and colleagues report on trends in invasive Group A streptococcal infections in 10 U.S. states from 2013 to 2022. They used CDC population-based surveillance from a network covering nearly 35 million persons. The authors found that the incidence of Group A strep infections is rising, especially in some demographic groups, as are isolates that are not susceptible to macrolides and clindamycin.
Yeah, those are really clinically important patterns. In the accompanying editorial, Doctors Osowicki and Lamagni observed that invasive Group A strep infections are more common in young adults now than they are in young children. Other populations with high incidence rates includes people experiencing homelessness, people who inject drugs, residents of long-term care facilities, and indigenous peoples. Preeti, you discussed the findings with the editorialists, as well as what's been happening globally around invasive Group A strep infections for the JAMA Author Interviews podcast.
Yes, we discussed some of the day-to-day things that can be done by clinicians in lieu of an effective vaccine for Group A streptococcus.
Effective clinical management of everyday Group A strep infections, so those ordinary things like sore throat, skin infections, and so on, is really important. If people don't receive antibiotics, they remain infectious for a long time, which means they spread the infection to other people as well as having a risk of complications themselves. So that's why I think in this paper, Chris Gregory and colleagues do really emphasize the importance of access to healthcare as a means of preventing the transmission of these infections and controlling their spread. So that's one thing. And the other thing is around outbreak control. And that's really, really important. So it starts with having systems in place to detect that you have an outbreak, and then going in and doing what you can to try and control these outbreaks, which is difficult. I spend an awful lot of time joining in these outbreak control team meetings to try and work with local teams around the country to control them. But there are things that can be done. And really the advent of whole genome sequencing has actually revolutionized our ability to detect these outbreaks early on, understand we have a problem, go in, identify the source of these outbreaks, how they're being transmitted, and put in place those control measures. So that's really key as well.
JAMA published an interesting research letter this week in which Dr. Prescott and colleagues report findings on 2 sepsis outcomes. The authors used the HMS sepsis registry data to assess 30-day mortality and in-hospital mortality or hospice discharge as outcome measurements for community-onset sepsis hospitalizations. They conclude that the composite outcome of in-hospital mortality or hospice discharge could be a useful measurement for sepsis outcomes.
JAMA published several thought-provoking viewpoints this week. In the first viewpoint, Dr. Edwards, a pediatrician and vaccine researcher, wrote about the recent increase in measles cases in the U.S. She describes the outbreak and advocates for scientifically based recommendations for immunization and infection control. In the second viewpoint, Drs. Jacobs and Booth write about vaccine misinformation and the erosion of science. They write about their concern for removing individuals who uphold scientific standards while appointing those who have spent decades undermining public confidence in vaccines. Professor Larry Gostin and colleagues write about the judicial pushback to the federal administration's withholding of funding for public health, global health, and USAID. And Professor Jonathan Cantor and Dr. Gaynor explain the rise of healthcare platforms. They advocate for antitrust attention as a small number of integrated health firms start to lead the way in healthcare platformization.
In JAMA's clinical content, Dr. Tong and colleagues reviewed another gram-positive organism this week, Staphylococcus aureus. The authors provide readers with a timely overview of the management of Staph aureus bacteremia. JAMA also published a patient page on ACL injuries, specifically in female athletes, with helpful information on ways to decrease injury risk and treatment after ACL rupture.
JAMA featured content about breastfeeding interventions in primary care to highlight the recently released U.S. Preventive Services Task Force recommendation statement. The task force concludes with moderate certainty that primary care behavioral counseling interventions to support breastfeeding have a moderate net benefit. Dr. Patnode and colleagues published the accompanying evidence report for this recommendation, in which they confirm the beneficial effect of breastfeeding support interventions. They conclude that these interventions can increase prevalence of breastfeeding up to 6 months.
Some important challenges to implementing effective breastfeeding interventions are discussed in the accompanying editorial by Dr. Demirci and colleagues. These include improving lactation education for providers, as well as dismantling other barriers. There's more JAMA content on this topic, including a patient page on behavioral counseling for breastfeeding.
To wrap up the clinical content, there are 2 JAMA Insight articles. One is about addressing health literacy. In this piece, Dr. Pash Orlo and colleagues offer recommendations for improving communication with patients. The other JAMA Insights is about strategies for communicating with parents about vaccines. This JAMA Insights explores vaccine hesitancy among parents and offers effective communication strategies for clinicians to build trust, handle difficult conversations, and ultimately improve vaccine uptake.
Listeners will also be interested in the JAMA Medical News article by lead senior staff writer Rita Rubin. She reports on how federal efforts to dismantle DEI initiatives might negatively affect clinical trials, both in terms of enrollment and representation.
Yes, thanks. I think our listeners will find that really worthwhile reading. This week's highlights are brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.